He was like my father. My uncle has always been there for me. That's why I also fought for him now, because I know that he wouldn't accept this. He would be really angry.
Moses Ntanda was 72 when he died of coronavirus in a Swedish care home for the elderly. His family has filed a police report and say there were several lapses in his care.
We called her uncle on FaceTime, and then we could see the staff behind him. They weren't wearing any masks, no gloves.
Moses suffered from dementia, but on the 12th of April he fell ill with COVID. Just 4 days later, he was dead.
The doctor told us that they're following certain protocols when it comes to the elderly. And my uncle, since he was so old and was also weak, they don't get the hospital care.
It was just being painkillers. They were not giving any oxygens, basically suffocating, and died when they were sleeping because they couldn't breathe.
I felt that they sacrificed the elderly, and it's very wrong, because I think that you should give everyone a chance to survive.
Moses passed away inside this state-run care home in Stockholm. Local authorities told us they can't comment on specific cases, but that they followed official instructions. And elderly residents were individually assessed by doctors, albeit sometimes online or over the phone. Sweden has seen more than 5,800 deaths from COVID, nearly half in care homes. Prominent scientists have criticised the authorities' approach.
They didn't try to save the lives of them. They were scared that the intensive care units would be overwhelmed and you couldn't take care of young people who were deadly sick. And so they were selecting a bit too harshly, I think.
The deaths of thousands of old people shocked Sweden. And in July, the Prime Minister announced there's to be a public inquiry focusing first and foremost on why there were so many COVID victims in the country's care homes.